Looks like we're ready to start. Good afternoon, everybody. Thank you for joining us. This is our Ask the Docs series. I am Dr. Mary Ambach. I hope you all had a good 4th of July weekend. For those of you who are attending us for the first time, this is a 30-minute question and answer session where Dr. Rogers and I answer your questions about orthopedic conditions or any topic regarding regenerative medicine and innovative therapies on treating these conditions. So every session we have a specific topic so that we can focus all our questions on the topic. And today our topic is bursitis. So if you are joining us at Zoom, you can go ahead and type your questions in the Q&A button at the bottom of your screen. For those of you who are joining us on Facebook, there's a comment section wherein you can type your questions regarding this topic. Unfortunately, Dr. Rogers will not be able to join me today. San Diego Orthobiologics Medical Group is our practice. It's located in Carlsbad in the North County of San Diego. And we diagnose and treat orthopedic injuries. And we specialize in doing regenerative therapies, which are innovative therapies that uses your own cells and tissues to heal your injuries naturally. So let's see if we have all our attendees logging in here. And I'm gonna go over your questions one at a time. And I'm gonna try to look at both Facebook and Zoom here for your questions. So what is bursitis? Bursitis is inflammation of the bursa. Now you would ask me, what is a bursa? A bursa is a sac-like fluid, sac-like structure that has fluid in between it. And these sacs are located between the bone and the soft tissue in our body. And they act as a cushion to prevent friction between the bone and the soft tissue. This soft tissue may be tendons or they may be ligaments. There's about 150 of these bursae in our body, and their role is to facilitate movement. So what causes bursitis? Probably the most common cause of bursitis is repetitive stress or overuse. Sports like tennis that can cause repetitive overhead activities can cause bursitis in the shoulder. Students who are in their desks for a prolonged period of time can also create bursitis in their elbow when they're putting their elbows in the table, and that causes prolonged pressure on those bursa, and that can irritate it. So that's another cause, is a prolonged pressure. Another cause is trauma. Whenever you hit these areas of your body that has a bursa in it, that can cause irritation of the bursa and inflammation of the bursa as well. So those are probably the three most common causes of bursitis: repetitive stress or overuse, prolonged pressure, and trauma. There are other conditions as well that can cause bursitis. If you have a tendon injury like a rotator cuff tear or a tear in your the gluteal tendon, that can cause irritation of the bursa, which is lying right next to it, and that can also cause bursitis. Sometimes patients develop these small bony deposits, which we call calcium deposits, and we see them for patients with got chronic tendon injuries. That's what we call calcific tendinitis. And this can also predispose you to a bursitis as it irritates the bursa underneath the tendon. Basically, anything that can affect abnormal motion or abnormal biomechanics in your body can cause bursitis. And that's where all these other orthopedic conditions like osteoarthritis, which can alter your gait, can also cause bursitis. In the knee itself, we've got a lot of bursa. We probably have, at least 5, 6, or more than that bursa in the knee. And it's one of the most common bursitis that we see. Other risk factors for bursitis are autoimmune diseases or systemic inflammatory conditions like lupus or rheumatoid arthritis, or patients who have gout as well are predisposed to bursitis. So let's go to the other questions here. Um, with regards to bursitis, what is the symptoms of bursitis? The most common symptom of bursitis is localized pain. These bursa are superficial structures. As I said, they're just lying underneath the soft tissue in your body. So you've got your skin, and then you've got your soft tissue, you got the bursa, and then you've got the bone. And the bursa is a very superficial structure. So whenever you have inflammation of this structure, when you press on it or when you apply pressure on it, it can cause localized pain. That's the most common symptom. And you can also have pain while moving the involved tendon or joint or structure that's affected. Rarely does it cause any referral pain to the other regions of your body. Limited range of motion is another symptom. And sometimes you can feel that it's inflamed, although it's not really visually swollen. It feels tight and inflamed. Next question here. I have a bursitis in my hip. What are the initial treatments that I should do? So in the hip, there's three common bursitis that we typically see in the hip. There's the trochanteric bursa, which is that bursa on the side of your hip. And then there's the ischial bursa, which is that bursa at your sitting bone. And then there's another bursa right in front of your hip joint in your groin. That's called the iliopsoas bursa. And whenever this bursa gets inflamed, either by, again, I said, if there's a tendinitis or there's osteoarthritis of the joint or any repetitive trauma, that can inflame this bursa. And we can actually see it nicely on the ultrasound. For those of you who have been in our clinic, the ultrasound is a really nice tool that can see in real time what the injury is. And when you look at this bursa on the ultrasound, you can see a sac. It has a lining, a white lining, and you can see the fluid inside the bursa. Normally, this bursa, when you're looking at it in the ultrasound, normally they're flat. There's really not a lot of fluid in it. There's maybe a teeny tiny bit of fluid that acts as a cushion. And sometimes you don't even see this bursa. But when it gets inflamed, it gets bigger because that fluid accumulates, and that's when we can see it in the ultrasound. And it makes it easier to treat with ultrasound because we can see the bursa itself, and we can take out the fluid that's causing the bursitis and inject some anti-inflammatory medications with it. So with regards to your question on the hip bursitis, the first thing that we recommend is activity modification. So whatever is the activity or the sports that created the bursitis in the first place, or that created the symptom, usually we let you take it easy for a week or two. Anti-inflammatories is the mainstay of treatment. They can be taken orally, like in Aleve or Advil. They can be applied topically, like a Voltaren gel. Or if you fail all conservative treatments, we can inject the anti-inflammatory, and that's what we call the cortisone shot. But initial standard treatment is taking it easy, activity modification, anti-inflammatories. Protective padding can help those students that I told you about that develops a bursitis in the surface of their elbow. There's some protective padding that can be placed in that elbow to avoid irritation of the bursa when they put their elbow in the table while they're studying. Also, assistive devices like crutches or canes can help unload the joint or the structure, and that can help with your symptom as well. And as I said, if you fail all those, the most common injection therapy that we do for a bursitis to give you immediate relief is the cortisone shot. So we use an ultrasound, and we can see nicely where the bursa is. If the fluid is large enough for us to drain, then we take out that fluid first, and we aspirate that fluid in the bursa, and that by itself actually can give you good relief of your symptoms. And then we inject an anti-inflammatory, most commonly a cortisone, into that bursa. and that takes care of the bursitis pretty quickly. However, if there is an underlying cause, which is most commonly the case for that bursitis, we need to treat that underlying cause. Otherwise, that bursitis is just going to keep getting back. So if you have, let's say, a tendon tear, we need to treat the tendon tear. If you have joint osteoarthritis, we need to treat the osteoarthritis. Physical therapy, I forget, is the most important treatment for this whenever you have underlying uh, cause for these problems. Um, because if you have, let's say, joint osteoarthritis or tendon injuries, you alter your biomechanics, your muscles are weak, you walk funny, you move funny, and that can just keep irritating your bursa. So physical therapy to strengthen the muscles and maintain flexibility is a very important treatment for bursitis. So another question here is, how can PRP or cell-based therapies help with bursitis? The way that the cell therapies come into play with regards to bursitis is, so when if a patient comes in and have a bursitis and we treat it symptomatically, we do standard treatments, and the bursitis still keeps coming back, and we find an underlying cause, let's say joint osteoarthritis, that's when the cell therapies come into play with the treatment, and that's when they become important. The cell therapies, as you all know, for patients who have been in the clinic, PRP or platelet-rich plasma is the most common cell therapy that we use. And it's a volume of concentrated platelets that we get from your blood, from your venous blood. And it's these platelets that contains thousands of growth factors, which are the ones that responsible for kicking in and stimulating that the healing process. And these platelets are something that we get from your veins about, the 30 minutes prior to your procedure. You come in earlier, we take out your blood from your veins. We have a lab in the back that processes your platelets, and the platelets are concentrated anywhere from 2-3 times to even 6 times more than your body concentration, which means that you have a super physiologic, super concentrated amount of growth factors that can start the healing process. And we do the injections on the same day. So you're in the clinic for about 30-45 minutes for the whole procedure. If we do the cell-based therapy, which is the other cell therapy that we use, these are different kinds of cells from your body, and they're called the mesenchymal stem cells, which are adult stem cells. And the stem cells are special because they have the ability to not only to renew themselves, but they also have the ability to turn into whatever cells needed by the body. So we get these mesenchymal stem cells from two sources in your body, either from your fat or from your bone marrow. So when you have more severe injuries, like more severe arthritis or a large tendon tear, we tend to favor using these cell therapies because they work better for more severe injuries. So that's when they come into play in the treatment of bursitis. It helps treat the underlying cause for these conditions. And with regards to the cell-based therapy, there's a question here: how long do I stay in the clinic, and what's the process involved? So the first part of the procedure is we take out the tissue from you. We aspirate the bone marrow from your superficial pelvic bone, and same as the PRP, we process your bone marrow and we concentrate it in our lab. And the concentrated bone marrow has platelets, it's got stem cells in it, it's got other proteins and growth factors that are not in the platelets, that it can lead to a more stronger effect with regards to the healing of your injuries. If we use the fat tissue, we take that from either your hip or from your stomach, or what patients call the love handles. And we use what we call a mini lipoaspiration. So much different from the liposuction that most of you are probably aware of or that you watch from YouTube. With the regular liposuction procedure, usually they use a suction machine and they suck out liters and liters of fat from you. For these therapies, we only need less than 50 cc of fat. So Unfortunately, it doesn't cosmetically change the appearance of your buttocks or your stomach, which is one of the most common questions that we typically get. But we use a mini lipoaspiration procedure. We use a very, very thin cannula to aspirate your fat. Instead of a suction machine, we use a vacuum syringe to aspirate the fat. That takes probably about 45 minutes because we need to let the numbing medicine sit um, first in your soft tissue before we aspirate the fat. And then after about 45 minutes, we do the procedure. So you're probably going to be in the clinic for about an hour and a half for the whole procedure if we use the fat-derived cell-based therapy. Okay, let me see other questions in here. How do I prevent bursitis? Most the most important thing for you to prevent the bursitis is to avoid repetitive activities. Some of you who are inclined to doing just one sport, for example tennis, you know how you're always doing that overhead motion. It's always good to change up your exercises. Maybe do tennis one day and maybe another day do a walking, or another day do yoga. So changing up your exercises can prevent you from doing these repetitive activities that's always involved with doing your sport. Lose weight if you need to, but really the main thing is to maintain that strength and flexibility in your body. Because if you have a good support for that structure, then whatever trauma you subject it to, your body should be able to hold that, and that shouldn't be a problem. Okay, so let me go into Facebook and see what kind of questions we have here. There's questions about joint. We're gonna answer those questions first. My husband has a tear of the superior labrum that extends and involves the ankle. He's 55 years old and plays golf. What would be the best method to address this? With regards to labrum tear, we just had a Ask the Doc series about this in a webinar. That labrum is that superficial portion of your cartilage that protects the joint and keeps the joint stable and in place. Whenever you wear out your joint, the labrum is the first structure that you'll see injuries into, and you can see that as tears. And most of the labrum injuries that we see are what we call degenerative labrum, wherein there's areas of the labrum that are worn out. If the injury is more involved, usually that labrum tears out, and it can extend into the structures next to it. So when it involves the anchor, that means that it involves where the other structures attach, like your biceps tendon and maybe some other structures. And that can make you more prone for instability. And whenever that it's unstable, that's a surgical treatment. There's other things that we can do in the clinic to help make the joint healthier, and that's how cell therapy can help. But with regards to keeping that anchor stable, if you are already showing some symptoms of instability, that needs to be surgically treated. All right, so let's click that as done. Let's go on to the next question. Is there any data on PRP and non-union sesamoid fracture? Okay, this is not really on our topic, but we'll answer your question. There's limited data on the use of PRP and other cell therapies for fracture on its own. There has been some data on using bone marrow derived cell therapy, maybe some on PRP on non-union fracture of let's say the clavicle or the collarbone. But I'm not aware of any data on non-union sesamoid fracture with regards to the use of PRP. Most of the time when you have a sesamoid bony involvement, it usually involves inflammation of the soft tissue around the sesamoid, or what we call sesamoiditis. And it can create injury to the surrounding soft tissue as well. And that can be treated conservatively. We can treat that with cell therapy. But with regards to the fracture itself, there has been some patients that we treated around the bone and the fracture, and that gave them symptomatic relief. Usually, these fractures, if it's a small hairline fracture, they just give it time. It's 6 to 8 weeks. It's a normal healing time. They do heal on their own. But if it's a non-union, there's other reasons why it's not improving on its own, and that needs to be further evaluated before any further treatments. Okay. How do the PRP and the cell-based therapies work? So for those of you who has been attending our webinars and our Ask the Doc series, you can probably answer this question for me. So PRP, as you know, that's platelet-rich plasma. The way that it works is it releases all these growth factors. There's hundreds and hundreds of them. And these growth factors have different jobs. But some of the growth factors decrease inflammation, which is probably what gives you the pain relief, the immediate pain relief from the PRP. Most importantly, there's a lot of this different group of growth factors that stimulate tissue repair. They stimulate proliferation of the tissue so that you can heal tendon tears or ligament injuries or cartilage injuries. They stimulate the formation of blood flow so that more nutrients and more cells can get to the area. They also enhance nerve repair. There has been studies that shown that patients with carpal tunnel syndrome or a sciatica in the back, if you inject PRP, it actually keeps the nerve healthier. So there's a lot of different factors. It's a little complicated, but those are the most common factors by how they worked. The stem cells work fairly similar. It's a little bit more complicated pathophysiology, but they work in a similar manner. So what these cells do is they actually release molecules. They act like basically like a mobile drugstore. They release all these molecules that are involved in healing tissue. And all these molecules also call upon other cells that are needed for the body to repair the tissue to come into the area. So that's what they call the paracrine effect. And depending on the signals that they get from the local injury, they basically call in whatever cavalry is needed in there to help repair the tissue. And that's what's amazing about this our cells. Our body is very intelligent in trying to heal itself. And what we're doing by doing this regenerative therapies is we're just giving your body a little push to help jumpstart this healing process, but we're letting your body do its own natural abilities to heal and support that. These stem cells also, they control inflammation. They have what we call an immunomodulatory function. They also fight infection. They have a natural antimicrobial properties to it. So it's rare that we have to give you antibiotics if we perform these procedures. Unless we're going into the discs, sometimes we do give you antibiotics to prevent infections. So, but most of these therapies do not need antibiotics for treatment. Okay, let's go on to the other questions. I'm trying to see there's data. Oh, that's right. We talked about that. The sesamoiditis, they had cortisone injections, temporary relief. Because of the anti-inflammatory effect of the PRP, that can actually, it acts like a long-acting cortisone. That's what I usually tell my patients. It acts like a long-acting steroids. The steroids, typically they last about 3 to 4 months, and then you have to have it repeated. And the problem with the steroids is that you can't really inject them on the soft tissue like a tendon or a ligament, because otherwise it will just make it more prone for rupture. So we can only inject them in the soft tissue around it. Like if there's a bursitis, we inject them in the bursa to take care of the inflammation. But if you want to take care of the actual injury, PRP would be a better option, because not only does it control that inflammation, but it also helps actually heal the injury, and so your bursitis doesn't return. So I hope I answered that question nicely. Let's look at our next question here. You are welcome, Adam. The good thing with bursitis is that if it's an acute bursitis, if it's something that you got for the first time, maybe from trauma or prolonged pressure, or you just overdid your activity, most of the bursitis actually get better over time. So if you ice it, if you modify your activity, you take it easy for a few days, take some anti-inflammatories, most of these bursitis do get better. So rarely do we have to do any further interventions. It's the ones that have underlying cause or injury for the bursitis, or what we call chronic bursitis, that typically becomes an issue, and that's when we have to intervene. So bursitis sometimes in on by itself is not really just a problem. It's usually a symptom of an underlying issue, and that's where we investigate. So how do we diagnose bursitis? We do a history interview with you. We do a physical exam. There's some information or data from the history and from the pattern of injury and on your physical exam that will give us a clue if it's a bursitis or not. And now with the advent of ultrasound, we have been able to diagnose bursitis, with 100% specificity and precision. Ultrasound has been very good at diagnosing soft tissue injuries. And as I told you, there's a specific look to the bursitis that is pathognomonic of the condition. So ultrasound, it's something that we do in the clinic. It takes 5 minutes to do, and it's very easy to diagnose a bursitis with the ultrasound. We do it on the same day. So when we see you, it doesn't involve any X-ray or any radiation. So it's a good tool to have, and it's been very helpful, not just for diagnosing orthopedic injuries, but also in the performance of these procedures. One of the most important things that you have to remember when getting these regenerative treatments is make sure that your physician does these procedures under imaging guidance. Most of the procedures that we do, we use ultrasound, for example, the joint injections and the soft tissue injections. Our spine injections, most of them we use it under fluoroscopy or a live x-ray, and that's how we can see the joints that we inject in the spine, or the areas where we need to put our needle to inject your epidural space. And sometimes we use both. We use both the x-ray. We have a large procedure room here. We got the x-ray in, which is this machine here behind me, and ultrasound at the same time. So make sure that whoever physician you choose to do these procedures, they do it under imaging guidance. That's the only way that you can know for sure that the injury is targeted and that the cells are being injected where they're supposed to go. They've actually done studies on procedures that has been performed under ultrasound guidance and procedures that have been performed without ultrasound guidance. At least 50% of these procedures are missed if there's no ultrasound guidance that's used. So that's very important to keep in mind when you're choosing your physician. All right, I think we've run out of time. That went by so fast. Thank you everybody for joining us. And if you have any further questions about bursitis, feel free to email us at admin@sdomg.com. Or if you have more specific personal questions, call us so that we can spend more time with you and we can be more specific with the answers. We have our webinar, not next week, but the week after. So watch out for your email or our Facebook announcements for that. And just to remind you, this Ask the Doc session, we do it every first Wednesday of the month. And then we have a more in-depth lecture session or a webinar session, which is on the second Wednesdays of the month. So thank you everybody for joining us. Feel free to contact us if you have any more questions. Have a great day. Bye-bye.